Thanks, Jake, and thanks ITP Australia and all the sponsors to making this day possible. I wasn't the only author on those guidelines. A lot of them are actually here in the audience today. I'm really excited to give this particular talk, though, because I have never prepared in all of my years a presentation on dietary supplements in ITP. And you know what? I get asked about this by nearly every single patient, and yet I've never done a deep dive. And it's a shame. And I suspect not a lot of your doctors would either, because it's not usually part of our arsenal of treatments. All of you, when you got your diagnosis of ITP, as long as it was since the advent of the internet, you would have Googled it, right? And a lot of you would have also Googled what you can do about the ITP. And a lot of the time, it would have been to look up what can you eat, what can you do differently with your lifestyle. And there are actually not too many bad sort of guides out there, and that's an example of that. But of course, now there's AI and artificial intelligence, and you can actually even inquire with ChatGPT what kind of diets you can eat or what kind of supplements you can try. But the responses, although they seem to make sense, there's something a little bit phony about artificial intelligence, and you can sort of see that it's not really been written about your disease or about ITP. It's often just with a broad brushstroke of diets that might be helpful for people with low platelet counts, or diets that might be helpful for people with autoimmune disease, but not necessarily your type of ITP. I'm going to get you to think about ITP from a slightly different perspective. Treatments often try to boost platelet counts. They try to reduce bleeding. They try to suppress the immune system. We heard a lot about that from Robert and Danny. And then sometimes we try to support the treatments that we use in ITP because we create side effects like infections or fatigue. But ITP isn't the only thing that determines your health. You don't just feel sick because of your ITP. Sometimes it's something as simple as issues to do with work or stresses. It could be relationships. It could be even other diseases that you have. These are all components of your health. And then on top of that, though, you cannot continue to exist unless you eat. So your health is a function of what you eat. You can't not eat. And so today's talk is really going to focus on what are those aspects of your diet that could be affecting those 4 domains. Has anyone heard of branched-chain amino acids? No bodybuilders in here? You've heard of them? So branched-chain amino acids are a type of amino acid that are found richly in certain types of foods, like red meat, salmon, grain, cheeses, those sort of things. When mice were given like a protein shake of branched-chain amino acids, their platelet counts increased by nearly 50 to 100%. And on top of that, when those mice were then having their platelets depleted with chemotherapy, the ones that were on the protein shake with branched-chain amino acids, their platelets came up a lot faster than the ones that weren't on the branched-chain amino acids. Now, in order to be able to recapitulate the kind of doses that mice had in humans, in us, roughly about half of our daily intake of protein would have to comprise of branched-chain amino acids if you wanted to replicate the same conditions as in the mouse studies. But that's not always going to be easy to do, but I suppose if you really were determined to, you can engorge on a carnivore diet. And certainly a lot of athletes will sometimes be prescribed or go on to branched-chain amino acid supplements, which you can get from health food stores. But it's not without its risks. Branched-chain amino acids are strongly associated with clotting, and sometimes people who have a diet rich in branched-chain amino acids tend to have more vascular disease. The mechanism by which branched-chain amino acids is said to work is through engagement of a certain mechanism called mTOR, which may actually interfere with other treatments for your ITP, depending on what else you're on. And then finally, the branched-chain amino acids haven't really been studied in patients with ITP specifically, but if there was a supplement that might help your bone marrow make more platelets, not necessarily address the ITP, one could consider branched-chain amino acids. Papaya leaf extracts. How many of you have come across a description of papaya leaf extracts as being something that might help your platelet counts? And how many of you have had those sort of questions dismissed by your hematologist? I know I would have probably until I'd read about this, but basically papaya leaf extracts have been found to increase platelet counts by trying to get your liver to squeeze out more of that TPO hormone that we heard about from Danny. And that's part of the reason why it's been used traditionally to try to help people recover from diseases like dengue fever, where the platelet counts have been low. And so it's been used for centuries in certain parts of the world. I know that quite specifically, though, there have been case series of papaya leaf extracts used in patients with ITP at a dose of about 1,000 milligrams 3 times a day. And on this graph, this is someone who was on both steroids and papaya leaf extracts. Platelet counts came up, stopped papaya leaf extracts, reduced the prednisone dose, and the platelet counts crashed. That's a familiar story. But then restarted on the papaya leaf extracts, and then the platelet counts came up. It just so happens that there will actually be some data presented on this at an upcoming international meeting this year with a randomized trial conducted in Thailand with not huge numbers from the abstract that I've read, but certainly there may be other ways of using traditional therapies like papaya leaf extracts. It doesn't always have to be very expensive. I'm not really sure what the pricing looks like in Australia, but definitely there are ways of getting it a little bit cheaper, a little bit more expensively. And the sort of side effects that some people have described are gastrointestinal and, of course, perhaps liver, because it does involve certain cytokines that might get the liver to do more work. There are, however, studies in animals where animals that have been fed massive overdoses of papaya leaf extract have survived. What about peanut skin extracts? Like, a lot of you would have come across peanut skin in a Google search, and it's been used traditionally in Chinese medicine to treat ITP. It's been shown to actually try to increase platelet counts by engaging a particular protein we know in the medical world called JAK2, and that's a protein that's important in stem cells, and it may actually offer an explanation for why PS1 or peanut skin extracts can try to jolly the platelet production process in the bone marrow. It's also got this dual role because peanut skin extracts are a polyphenol, which I'll talk about in a sec, and polyphenols have antioxidant abilities, and in general you sort of would hear about antioxidants as being great for dampening down inflammation. And in this busy graph, mice who were given chemotherapy would usually have their platelet counts crash, but when they were given these peanut skin extracts, their platelet counts actually stayed normal. When they looked inside those mice bone marrows, they could see those bone marrows actively trying to spit out more platelets. But studies or carefully designed studies haven't, to my inspection, have been performed in ITP. And so this is obviously another area of uncertainty, but might be an area of promise in the future. And it's not really as simple as just engorging on a big handful of peanuts with skins on them. To get that kind of dosage of peanut skin extract often involves a pretty lengthy process of extraction. So it's not really clear, but it's certainly something that might hold some promise in the future. Vitamin A comes in many forms, but its most active form is something we call in medicine ATRA. Vitamin A is a vitamin that's seen quite commonly in a lot of vegetables you might usually choose from the grocery store, like carrots. But ATRA, which is the most active form of vitamin A, has been shown to be really important in trying to stimulate the bone marrow to mature and to grow quickly. It's also been seen to try to help those chaperone cells in the bone marrow so that the bone marrow doesn't get too damaged by immune attack. And actually, there have been well-designed studies using ATRA, the very active form of vitamin A, in both patients who've newly been diagnosed with ITP, as well as patients who've had ITP for a lot longer in combination with other drugs like danazol or high-dose dexamethasone, and also even rituximab, with responses that don't seem to disappear over time. But in order to get that kind of dosage in these trials, it's about 10 milligrams twice a day of this highly active vitamin A. You can't get these tablets easily, and to be able to have the amount of vitamin A from your diet would require quite a lot of those vegetables. Using ATRA can sometimes also cause side effects like headaches and dry skin. Melatonin, like some of my patients will know that I've been suggesting they give melatonin a go, particularly if they suffer from insomnia. Melatonin is one of those neurotransmitter proteins that's found naturally in certain foods like cherries, milk, oats, fish and bananas. But when you eat it, not a lot of it gets absorbed successfully. So that's called bioavailability. It's pretty low. But that's okay, because melatonin gets made inside your brain in a gland called the pineal gland. But it's made by first starting off with ingesting food that has lots of tryptophan. And the tryptophan goes through various stages of enzyme processing before it becomes something called serotonin. And eventually the serotonin gets into the pineal gland and gets turned into melatonin. Serotonin, you may or may not know, is a neurotransmitter where about 90% of the serotonin in your body is actually carried around in your platelets. And when you destroy your platelets as rapidly as you do in ITP, it's suspected that your total body pool of serotonin is a lot lower. You'll also know that serotonin reuptake inhibitors are often a part of treating diseases like depression and anxiety. And it may, to some extent, answer some of the questions about why some people feel symptoms like fatigue. Melatonin has been used in trials with ITP. In case series with ITP. In big doses, though. Doses of about 10 milligrams at 2 p.m. and 20 milligrams at 9 p.m. And those doses will make most people drowsy. But there are numerous case reports in the literature in ITP where platelet counts have gone up using those massive doses. The platelet counts also go up in patients without ITP, when they just have, say, liver disease. Their platelet counts go up just by having melatonin in big doses. And of course, it's not so easy to get those sort of doses of melatonin in Australia, but there are certainly a lot of foods that might have tryptophan in them, and tryptophan obviously eventually gets converted into melatonin. But what if instead of trying to boost the platelet count, we just wanted to focus on, well, the bleeding, which is an important aspect of ITP? Blood clots, or clotting, I explain to a lot of patients, is being like a brick wall that you're making inside your body to stop you from bleeding. And to make that brick wall, you need the bricks, which are platelets, and you need clotting systems or clotting proteins, which are like the mortar. But any builder would know you don't just build brick walls on nothing. You need to build it on something like a concrete base, and that's collagen in your body. So people who are deficient in vitamin C have trouble making collagen, and it makes their skin more fragile, or it makes their blood vessels more fragile, and they're not able to make strong brick walls without that concrete base. And which is why many years ago, when people had scurvy by not having enough vitamin C in their diet, one of the symptoms would be that they'd bruise and bleed too easily. Vitamin K is another vitamin that's easily found usually in any green leafy vegetable. If you happen to be deficient in vitamin K, it's possible you'll bruise and you'll bleed more easily. So making sure that you increase your vitamin C intake and your vitamin K intake just by having lots of healthy green leafy vegetables might do you some service, particularly if you're finding that you're bleeding a bit more easily than before. But there are also things that can detract from your ability to make blood clots properly. There are a lot of drugs and medications and foods that can affect platelet function. Those of you who were here at the patient meeting last year in Canberra will remember that we did an analysis of your platelets to see how well they were functioning, because basically a platelet count is one thing, but it's the quality of those platelets that can sometimes matter more. We can affect that quality if we drink too much alcohol. Even foods like garlic and onion, spices like cumin, fenugreek, tamarind and turmeric can affect your platelet function enough for us to notice when we do platelet function tests in the laboratory. Even traditional herbs that are used to try to help with your circulation, like fish oil or ginseng and ginkgo biloba, that are used specifically to try to help when you have, say, a vascular disease or you've had heart attacks in the past. These are things that can actually make you bleed more easily by gently affecting your platelet function, as well as also St. John's wort and chamomile. What if we moved on to talking about the diet now? To talking about suppressing the immune system with your diet. One of the things that you'll come across is discussion or recommendations for an anti-inflammatory diet, or a diet full of polyphenols and antioxidants, or a Mediterranean diet. These are diets that are rich in olive oil, olives, vitamin C, teas, caffeine, coffee, chocolates, those sort of generally yummy things. But all the other stuff, all the highly saturated fats, the processed meats, even the red meat, would be things that would be generally excluded from an anti-inflammatory diet. But despite the ease with which you'll find recommendations to adhere to an anti-inflammatory diet, there is very little evidence to support it. There are genetic tests where, when we look at genetic predisposition to having higher omega-3 levels in your blood, so this isn't from eating it, this is just being born this way. When your omega-3 levels are a little bit higher, it lowers the risk of diseases like lupus and Crohn's disease. If you have genes that give you a higher omega-6 level, though, that can increase the risk of various other autoimmune diseases like rheumatoid arthritis and lupus. And omega-6 is found very easily in foods like vegetable oils and nuts and seeds. But remember, these are genetic tests. These aren't from people eating extra amounts of omega-3. These are people who are born with a predisposition to having higher or lower levels of these fatty acids. There's absolutely no evidence that I could find on omega-3 and influencing or affecting the diet and any outcomes in ITP or platelets. There have been mouse studies in fish oil improving symptoms of lupus in mice. And certainly diets rich in polyphenols have been given to people, and then they've measured inflammatory markers, which are like proteins in your bloodstream, and they seem a bit better when you're on a high polyphenol diet, but this is not necessarily anything to do with ITP or platelet counts. And remember, there are certain things like fish oil and omega-3 fatty acids that can affect platelet function. So if you happen to be someone who bleeds rather easily, it may not necessarily be the best choice for you to embark on an anti-inflammatory diet. And certainly when people have spiked polyphenols into test tubes to measure what happens to the platelets don't function quite as well with the polyphenols in them. And this is probably part of the reason why they're helpful if you have vascular disease or disease that causes clotting in your heart, in the arteries around your heart or in your brain. However, there have been other studies where people have been force-fed lots of polyphenols and then had their bloods taken to see what's happened to their platelet function, and those results have actually been contradictory. So what are you going to believe when even we don't really know what's going on? Others may have come across something called an autoimmune protocol, and I think some of you in the room who are my patients have been on this on the advice of nutritionists. The autoimmune protocol involves 3 sort of phases where you firstly eliminate pretty much all of those things that you can see on the left-hand side. And then when you feel well, when you feel like your autoimmune disease is better, you slowly start to reintroduce one of those ingredients at a time. So that's the reintroduction phase. And then when you get to a point where you feel fantastic, that's then called the maintenance phase. But again, despite ChatGPT and all sorts of doctor Googling websites recommending an autoimmune protocol, there's never been any evidence that I can see in ITP itself or in any way substantiating any improvement in platelet counts. It may have more relevance in people who have actual allergies to certain foods, and that's certainly one way in which allergy clinics try to help people, but this is not necessarily something that's going to help your platelets. And then what about other therapies or other sort of ways in which the diet can affect the treatments that we use already for your ITP? Pretty much everyone here who's been diagnosed with ITP will have had a course of steroids, whether prednisone or dexamethasone, and you all know all the side effects of those steroid drugs. When you are afflicted by things like insomnia or the high phase of the steroids, it would be advisable to avoid things that would keep you awake, like caffeine, and maybe try that melatonin trick. And again, trying to avoid caffeine and spicy, oily foods when you have the dyspepsia from steroids, or calorie-dense foods if you're starting to gain weight, or avoiding sugars, and having a healthy, balanced diet rather than a very calorie-restricted diet if you're getting problems with fatigue and energy levels. And don't forget to keep your bone health strong with optimizing things like vitamin D and calcium in your diet. When you come into trouble with ITP, a lot of you would have received intravenous immunoglobulins, and a common side effect of that are usually headaches. It's always important to try to maintain as much hydration as you can. Often that can help reduce the onset of things like migraines and aseptic meningitis. And of course also avoid things that might dehydrate you, like alcohol and caffeine. And we've already heard from Rob Bird before that there are some things that you have to be mindful of when you're taking certain medications like L-trombopag, as they can as the absorption can be affected by anything else that's also in the stomach, like iron supplements or calcium supplements. Speaking of iron is a really important topic in the diet for anyone with ITP for a bunch of reasons. Firstly, if you're bleeding a lot, then you're more likely to be iron deficient. A lot of the younger patients with ITP will be ladies, and you might be going through menstruation, and that will also lead to further iron loss. And of course, there might be dietary choices like those in anti-inflammatory diets that you may have been on that can affect your iron absorption. And of course, that key question that keeps coming up about fatigue, iron may absolutely be part of the problem with some of you with fatigue. Iron and vitamin C preparations can be really effective at increasing your iron levels, and of course we talked about why vitamin C can be helpful in ITP, but a lot of the oral treatments do cause a bit of constipation or gastrointestinal problems. Be wary of those homeopathic iron tablets. You'll find them in the chemists. They often say this is for iron balance, and then actually on the packaging itself there's a little warning that usually says not to be used if you're deficient in iron. So yeah, definitely avoid those. And sometimes intravenous iron infusions can be the quickest way to try to get your iron levels up. There are newer preparations that cause less electrolyte problems and less osteoporosis. So if you do get to that point, be mindful of asking your doctor to see if there might be a newer option available to help you with that. And of course, if bleeding recurs, even if you're thrombocytopenic, if bleeding keeps coming back at the same place, like nosebleeds or in the bowel or always in the urine, it may be important to actually get that checked out by a doctor in that actual field. It's not necessarily just because there's not enough platelets. It could be that there's an abnormal blood vessel or an ulcer somewhere or a fibroid polyp in the uterus, which is what can actually be the cause of all that bleeding. And watch out also that in a lot of patients with ITP, there will be gluten intolerance and thyroid diseases, and these can not only affect your energy levels and fatigue, but also your iron balance. So with fatigue itself, there are a whole bunch of causes that your doctor will usually make sure that you don't have if you do complain of fatigue, like thyroid disease, but other things can cause fatigue, like poor sleep, insomnia, muscle weakness, iron deficiency we spoke about, but also mental health. And as I mentioned before, platelets are the major reservoir of serotonin in the body. And serotonin is really important. It's the most important neurotransmitter for your nerves to be able to communicate to one another. And it may be that low levels of serotonin are affecting not just your mood, but also sleep and digestion. You'll note that if any of you do get put onto a serotonin reuptake inhibitor because you've also been diagnosed with depression, there are often warnings on the box that it may increase the risk of bleeding, and that may give you pause. Certainly, they block serotonin from entering the platelets. But in general, if you have a mental illness like depression, it's probably a lot better to treat it rather than and then deal with any bleeding that comes from it rather than not treating the depression in the first place. And if you are particularly worried about the serotonin levels, there could be supplements like tryptophan, which is a building block that becomes serotonin, that can maybe help support your serotonin levels. But again, there's no evidence of, people with ITP having handfuls of tryptophan tablets, experiencing great boosts in their energy levels or fatigue or their platelet counts. But there are foods that you may naturally just gravitate towards in aid of this, like eggs and dairy and fresh fish and nuts and so on. And I just will finish up with an example of one patient who came to me and told me about a recipe for a tea that she had, that she'd been using. And I'm going to call it Kate's tea. It's got cinnamon, lemon juice, apple cider vinegar, honey and hot water. This is a patient who for many years had platelet counts in the 20s and 30s. Even before I'd met her, she was on long-term steroids. When I picked her up, we got her off the prednisone and got her onto a clinical trial. And since then, her platelet counts have come up. But actually, they mostly came up after she started drinking this tea cocktail that she started. And then along the way, her progress has been punctuated by at least 3 episodes of COVID. And every time she got COVID, her platelet count spiked up and got to a new plateau. So I don't really know why her platelets are a lot better than what they are. It could be the clinical trial she's on, it could be the tea, or it could be her immune system getting reset every time she's had a major infection. I don't know. But she enjoys the tea. So I'll just finish up by saying there is an I in diet. Individualize what you do to suit your own needs. It may be that you need to boost your platelet counts, or you may want to just focus on the bleeding, or you may want to affect your own immune system and try to go on one of these fancy diets. Or maybe you just need your diet to help you support your other treatments for ITP. There are competing priorities in everything we do, but also in ITP management. There is always conflicting information online, like we saw about polyphenols and bleeding. And the context of the evidence that's presented to you is really important. Just because it happened in mice or just because it happened in, say, another disease doesn't mean it's going to help patients with ITP. And life is absolutely going to be a balance of risks. Cigarette smoking will probably help promote clotting if you bleed too much. But there's a lot of harm to come from taking up smoking, so you wouldn't recommend that. But at least if you think about your health through your diet, it may be one way in which you can actually actively engage in your own health and actually try to help yourself in ways that you don't always feel you have that agency, because you're often just waiting for the doctor to tell you what to do. Thank you.